Now talk about another bone cancer. Okay, as of course we are talking about cancers of the tissues of the body. So moving to what is known as osteosarcoma. Okay, we get to talk about what is osteosarcoma. So of course, from the word osteosarcoma, if you look at osteo simply means a bone. Sarcoma, of course, is a cancerous growth. So osteosarcoma, you should know that it's actually one of the most common type of cancers that could actually occur to the bone, and usually affect teenagers, affect adults, and often affect long bones. Okay, you usually see in the knee, or you see it in the shoulders. Okay, so it's usually in the knee or in the shoulders, right? It could actually occur any other place. We are just trying to say it commonly occurs at these places. So it's aggressive. It has a tendency of actually spreading to other parts of the body, especially when it gets to the lungs. It gives you a lot of breathing problems, and you could basically die of that. So definition is a malignant bone tumor, and it arises from cells that will form bone. That's all of them, osteoblasts and the rest of it. So it's rare overall, but it's actually the most common bone cancer in children and adolescents. About 1,000 cases are announced, and we're talking about yearly. Usually the long bones, the femur, the tibia, the humerus. Okay, mostly affect teenagers between age 10 to 20. Okay, so it can also occur in adults. Okay, alongside other bone diseases like the Paget disease. Okay, so symptoms: there's a lot of bone pain, swelling or lump in the place, limited movement, and your bone is weak. So your bone could actually fracture because of the weakness, and sometimes may be mistaken for all those sports injuries. So causes and risk factors is it can be associated with some genetic syndrome like the Lee-Fraumani, Bloom syndrome, and the hereditary retinoblastoma. So it can also be associated with Paget's disease, fibrous dysplasia, and if the person has previously had a radiotherapy or chemotherapy session. Okay, so I think that's it. So you diagnose it from imaging, x-rays, MRI, CT scans, bone scans, PET scans. You can also take some biopsy just to confirm it. So you treat with chemotherapy, or you might actually want to cut the limb that is actually affected. Amputation if you feel like the tumor has a tendency of actually growing to other places. Then rotation plasty. Okay, then also radiation therapies. Okay, following up with all those radiation just to kill the residual cells.